I have nothing on his, yeah. He can't quite flip them on his own yet. But again, it's gonna take some time just with how severe his injury was initially. I'm sorry, do you wanna pull that? I know, I'm gonna hold your head here. You get to be an orca. That's nice. It says don't touch it.
Feel that.
But yeah, the good thing is the morning after surgery, he had already regained the feeling in his paws.
Ah, that's
so,
nice.
Yes. Very important. If they don't get that back, then it's not good.
Mm-hmm.
Yeah. Oh. He is very fuzzy. He has a lot of shaved spots, obviously.
Yeah.
So his chest is shaved, legs shaved.
Poor little buddy.
It'll grow back.
He was supposed to go to Big Grandma on Tuesday.
This was his way out.
That's right.
He's like, you know what?
Yep.
Let me throw my back out instead.
He's like, we're gonna tweak the back,
Yeah.
and then we're gonna
Then it gave you guys a scare watching him.
lose the legs.
Yeah.
I thought his legs were asleep. It was like,
Yeah.
you just had a long night because he hadn't been moving very much. So
Yeah,
I was
yeah.
like, maybe.
Yeah.
But
I'm sorry, you could still.
it didn't come back.
It's like a nightmare.
Just scoot himself around. I'm like,
Yeah.
it's not good.
No, it's not. But you got him in time, you know. The worst is when it waits too long.
We weren't gonna let him go too long.
Yeah, no, I think we're. Oh, no, you can do this, and then we'll just do the edges of the hair of the purple side. Here, I know, folks. You can go boy. Oh, that long hair.
Been through a lot more than most 4-year-olds.
Hmm?
Been through a lot more than most 4-year-olds.
Yeah. Cotton balls. Just the best.
So, do you know what can it cost that in order for us to avoid some things?
Sure. Some are just. It can be super random. Certain breeds are predisposed. French bulldogs, because they're just.
Poor.
Yes, thank you. Trying to say it nicely.
And just
They're genetic nightmares. So they're the most ones we see. Dachshunds with the longer back. Havanese also longer back. Havanese aren't as popular of a breed, or like not as common, so we don't
got
see
a
them.
little bit of that in there.
But yeah, longer back activity, like we're saying, like kind of like the up and down activities, stairs, jumping onto furniture and stuff.
So he
Wrestling.
likes to do those things.
Ideally.
He likes to crawl underneath furniture.
Okay, that shouldn't
Which-
do it, but
No, but he's, as previously established, overweight.
yeah.
And they're tight spaces.
Yeah.
So I really maybe thought that could be
It's hard.
first
Sometimes-
domino, and
Yeah.
then jumping off the couch in the middle of the night
Maybe.
was like the kill shot. But
Yeah, it can be luck of the draw too. We see it happen to any type of dog. It's an unfortunate thing.
Yeah. He loves to run, in the backyard, but
Yeah.
crazy.
Yeah.
I was thinking, maybe, oh my gosh.
Running shouldn't, direct running shouldn't do it. Just like a normal dog run. So it's normally like the jumping, twisting kind of
he
thing.
took a sharp turn and a tumble.
Could be, yeah.
Hmm.
But it's hard. It's in the underdogs. He's young. He's gonna be active.
Yeah.
He wants to.
Yeah.
You can't just keep them in a bubble. So it's trying to minimize, like I said, running up and down long flights of stairs, trying to avoid extreme jumping, that kind of thing. But he's gonna run.
Of
know?
course, yes.
So-
Yeah.
So there's only so much. You say like getting stairs for furniture for some dogs helps if they'll use them.
Stairs.
Yeah,
He hasn't learned how to use it. But
yeah. That's the other thing.
Not
They're
really
dogs.
the other two.
Yeah. So it's hard to tell them what to do. But yeah, ideally minimizing that kind of thing.
Little buddy.
No, it's okay. You're so sad. There's no straightforward unless you're going to keep them in a bubble. But just try to avoid extreme activity.
Yeah.
Coughing you'll sometimes notice as well. Endotracheal tube that goes down their throat during surgery, sometimes they'll have a cough. So, yeah. with the passive range of motion, what we're gonna look at doing, you can stand straight. So what you can do is just stretching their hip directly back, just to help stretch out the groin muscles there. As you can see, he's not flipping his paw yet. But even just with giving him support, placing his paws correctly, and he's just, of course, going to be curling his in for now. But in a couple days, ideally, once you start placing his paws correctly, just seeing it, basically just getting him used to where they should be rather than, because he's just not aware of where they should be placed right now. So just seeing if he starts, how quickly, or when he starts developing that response again. The other one is just doing the little bicycle kicks range of motion. They're so fluffy. Just trying to get them moving without him obviously bearing weight on them. And just trying to move them around. And this is all just as long as he tolerates it. He doesn't have to be standing for the stretching his hip back. He can be laying down on his side. Same thing for doing the little bicycle kicks. Obviously with him trying to get his paws placed correctly is gonna take a little bit of time there. But can certainly practice that. Right, bud? And then with the bladder expression,
Oh boy.
it kind of varies. Let me go that way. Do you mind just holding near his head so he doesn't try to throw himself off the table or something? Usually with the bladder expression, when you feel up here, you would be feeling almost like a water balloon. And then just slowly like that, yeah. So if you,
That's not bad.
yeah, it's not too bad. And like he's not super hard to do it with, but literally just kind of massaging this area and then going downward.
Okay.
And like I said, I'm sorry, I don't want to make you pee on yourself. You gotta pee hand real quick. With,
It's pungent.
it is, that is spinal cord
They
injury.
did say that in the instructions.
Yes, so it is gonna be more pungent than usual. Just because he's not gonna probably, like I said, he's not peeing normally. So with it building up until he either finally lets go or you express his bladder, it's gonna smell more than usual. If it's anything very intense though,
There he goes.
yes. I've been smart, I would have worn gloves, but we are too far gone at this point. So you'll see, eventually they'll just, and sometimes you just need to get them started and they'll just go on their, oh, I'm sorry, honey, I know. And they don't like it usually, which is why we say try to let them urinate on their own.
Maybe, they feel a little bit
It's
uncomfortable,
uncomfortable.
yeah.
And you'll notice they'll tense up their abdomen and everything too. I'm sorry, I know, you're okay. We'll stop you now. I know, bud.
It's like a two-person job.
So,
Yes.
2 people, yeah.
Yeah, 2 people ideally. You can do it when they're on their side and just kind of like reach your hand under and go like that. I'm sorry,